Welcome to the Dose of Optimism, where I talk to the optimists in healthcare. My name is Omkar Kulkarni, and I work at one of the world's best children's hospitals where I lead innovation. I started KidsX, which is a premier international startup accelerator for pediatric innovation. And over the years, I've met thousands of startups, investors, and innovators. Every one of them has a story, and every one of them is optimistic about the problems they're solving. On this podcast, you'll meet amazing people who will share their stories and what makes them optimistic about the future of healthcare. A little note before we get into this episode. This podcast is for informational purposes only. We are not offering medical advice, and we're not endorsing any products. Please talk to your own physician about your health or the health of your children. All right, let's get started. Today's episode is about hunger in America. There's somewhere around 48 to 50 million people in the United States who are food insecure, or in other words, they don't have consistent access to enough food for every person in their household. And this includes 13 to 14 million children, which when I learned this was wild to me. For the wealthiest country on the planet to have 1 out of every 7 people be food insecure. I was born and raised in America. My family is Indian, and so as a child, I remember going to India in the summers and seeing children on the streets begging for food. I remember seeing families living on the street in makeshift housing. For a long time, that's the image that came to my mind when I heard about hunger. But in America, food insecurity looks a little different. While yes, the data does include the people who experience homelessness, it also includes millions and millions of families who we work with and go to school with and interact with regularly. They just don't have the means or the access to healthy, nutritious food. Today, we start to dig into this issue and some innovative solutions to help families facing food insecurity. Our first guest today is Dr. Jessica Knurick, a registered dietitian with a PhD in nutrition science, specializing in chronic disease prevention. She educates on topics related to nutrition science, food, nutrition policy, and how these factors shape public health. She talked to me about the challenges we face from an infrastructure standpoint and some ways we may be able to solve for them. I'm excited to introduce our next guest, Dr. Jessica Knurick. She's a registered dietitian with a PhD in nutrition science. She specializes in chronic disease prevention and is known for her work in nutrition science, food and nutrition policy, and public health education. Jessica, thank you for joining us today.
Thank you so much for having me. I'm excited to be here.
Food is so relatable for all of us. There's this unique connection to food and our health that I think people feel specifically connected to. I think it connects people particularly from a children's sense. Tell me how you define food desert. And as we think about food deserts and their impact on children accessing healthy food, what are some structural barriers that are there that you think sometimes get overlooked?
A food desert is an area where people lack access to nutrient-dense foods. When we think about that term food desert, a lot of us go right to like rural areas. If you've ever driven across the country, there's these towns where people live, but there's not really a grocery store readily accessible. It would be considered a food desert. But that is actually a very small percentage of the food deserts in this country. The vast majority of them are actually in urban areas. It's really the result of intentional policies through things like redlining, created these areas. There was a lot of disinvestment, infrastructure, and businesses ended up leaving those areas and going to areas where there was more money. A lot of grocery stores and grocery chains left those areas. What people were left with were gas stations and corner stores and fast food restaurants. They lacked access to grocery stores. Millions of people live in these food deserts in the United States. It's a huge barrier to accessing nutrient dense foods because they really have to rely on what is easily accessible to them.
And I imagine that people who are responsible, perhaps for policymaking, don't live in a food desert. And so there's this divide, perhaps, between those that could be part of a solution with those not even encountering what a food desert looks like, at least on a day-to-day basis.
I think a lot of people in this country have never even heard that term before. I certainly didn't really realize how many people were living in areas where there wasn't a grocery store close. I grew up in a smaller town in Michigan, but we always had a grocery store and we had a car, right? So that's another issue in these areas. You can get to a grocery store, right? But a lot of these people don't have the transportation to drive 10, 15 miles to go to a grocery store. And so that becomes a big issue. A lot of the people creating the policies haven't really worked in these areas before or have never lived in the areas either. I think that there's this kind of misunderstanding and misconception about what is actually needed to improve those barriers. There's a lot of other barriers to accessing fresh, nutrient dense foods as well.
I was reading about how in Europe they've started building these micro grocery stores with fresh foods in public transport hubs like train stations and bus stations to really connect those urban areas like you were talking about and people who may use public transport instead of cars by just putting these types of little food groceries and food marts that are accessible to anybody, but specifically those people who may rely more on public transportation, which I thought was interesting.
Yeah, that's a great solution. And some people are doing work to solve some of these issues, right? Like we have mobile farmers markets that some nonprofits go into these areas, set up a stand, and people are able to get fresh fruits and vegetables. Those oftentimes rely on grants, like federal grants, for those types of programs. So we have to incentivize those programs.
And I think there's examples of a lot of those in a lot of urban and rural markets, which is helpful considering what you're describing and as to where these issues particularly lie. So, connected to health for us. So, we've got food deserts or these structural limitations to where people can access healthy, nutrient rich foods. What kind of evidence do we have that this is creating unhealthier populations, particularly amongst children?
Every time where there's a food desert, it's also strongly correlated to poverty, right? Most of the times, especially in these urban areas where we see food deserts, they're highly poverty stricken areas, and poverty is directly related to health. So, in this country, when we think about who is most impacted by these lifestyle related chronic diseases or poor health, low income populations are 5 times more likely to report poor or low health than their wealthier peers. They're 2 times more likely to have type 2 diabetes, and their life expectancy is consistently much lower. There's some research to show that across the United States, men in the lowest income bracket live 15 years less than men in the highest income bracket. And for women, the gap is 10 years. When we're thinking about who is most impacted, it's really these people in these low income areas. And so if you're just trying to improve the health of a population, who's most impacted? And then what can we actually do to improve health outcomes in that population? That's what, from a public health perspective, we would focus on. So we would look at, okay, so we have all of these issues in these areas with food deserts, high poverty areas, and how can we get them accessibility to things like food and nutritious food? How can we get accessibility to things like healthcare and safe drinking water and all of those types of things, just to try to make sure that they have their basic needs met?
Okay. So let's connect that to the pediatric health systems that are out there. So children's hospitals and health plans that are helping children. If you were to recommend a solution that the children's hospital could take on to help address these barriers, these structural challenges, what would you advise them?
There's screening tools for food insecurity. A lot of people, first of all, they don't know what that term means. They don't really recognize it. If they have access to fast food next door, they don't necessarily think, oh, I live in a food insecure household. Food insecurity is really looking at, do people have access to the foods they need to meet their nutrient needs? Screening for food insecurity, growth issues, dietary habits. A lot of people, they may have accessibility to calories, but they don't have accessibility to their nutrients. And so looking at that. And then once people are trained on that and being able to kind of screen for it, really being able to address those barriers. A big thing that people can do is helping them connect to resources like WIC in the area. WIC is Women, Infant, and Children, and it's a wonderful program. A lot of people qualify for WIC, but they don't realize it or they don't know that it exists or how to access it. Just having somebody tell them this is a service available to you if you want it. WIC really is wonderful because it gives direct food assistance, fruits and vegetables, nutrient dense foods to women, infants, and children. And it can help with formula, for example, in infancy. And so that's a great one. Helping people connect to SNAP, which is the Supplemental Nutrition Assistance Program, which can help people get direct cash for groceries. And so it can help with their grocery bills. There's also local food pantries that are around. And a lot of these things, again, people just don't know exist, and they exist to help them and to help decrease food insecurity. So really doing that, I think, are some of the best things. And I think some hospitals are implementing these things like food pharmacies and like food prescriptions. That's something that some of the clinics are doing. But then also offering educational services. So education is a big barrier for people, and particularly with the parents. You can bring a dietitian in and offer an educational class about healthy eating, or even just not even a class, but you can give guidance, you can give flyers, you can give things like that that have all of these resources on them. I think can be really helpful.
What you're describing is screening, a regular screening for food insecurity or for any version of potential barrier to access to food, coupled with identifying clinical populations that may have a unique need for specific types of food. So you described earlier your work with diabetes populations. There's other populations that have a unique need for making sure they've got access to specific foods. And when you couple all those, you get high risk populations that particularly could have poor clinical outcomes if they don't have the right food. And so then connecting those families against systems approach, you've screened, you've identified, you've risk prioritized, you've got WIC, you've got SNAP, you've got other programs that are available, making sure those families are enrolled and then have access to the service providers or stores or food pharmacies that can actually deliver food or make that food available in case they live in a desert.
Yeah, that's exactly what I would say. I'm just a big advocate for is just help advocating for policies that help things like increasing Medicaid reimbursement for nutrition counseling for RDs. Registered dietitians can be very helpful here. They're trained in how to talk in a culturally sensitive way and just a sensitive way overall. They're taught about these programs, and the unfortunate thing is that it's very difficult to get reimbursement for registered dietitians. And so educating practitioners too on when and how they can use RDs, and then again advocating for more increased use of them.
So, my last question is if you could make one policy action to particularly address this specific issue around food insecurity and access to food, what is one policy you would push for?
Wow, that's a big question. I think one of the biggest reasons that we have these food deserts is those were policy-based decisions looking at why our food system is this way, which is that's a lot of the work that I do is looking at why do we have a food system that is predominantly by best estimates it's about 70% of these ultra processed foods. Why do we so heavily rely on these prepackaged ultra processed foods? And it's because we've built a food system that's really prioritized around profit and not people's health. And so trying to chip away at some of that and being like, okay, right now our agricultural subsidies heavily go towards corn, wheat, and soy. A lot of that doesn't even end up in our food. And the part that does end up in our food really is artificially making these low nutrient, ultra processed foods lower in price. How could we decrease the price of fresh fruits and vegetables? How could we incentivize farmers to be growing more fresh fruits and vegetables through things like grants and helping them to modify these things?
And what you're describing is a macro issue that involves food and how we ensure that everybody has not only access to, but is informed about and can afford the food they need to live healthy lives, particularly for children and families.
Yeah, that's exactly right. And there's a lot of different aspects of health, right? We call them the social determinants of health. And so when you think about like how can we improve children's health, we really have to think about those social determinants. So big one is poverty, which I just mentioned. Another one is the built environment. So where are these kids living? Do they have easy access to movement and exercise? Are they able to just walk down the road? A lot of our towns and our cities don't have availability for that because of our infrastructure. And so there's not a lot of sidewalks or parks. So thinking about how can we bring more green spaces into areas so that people can be running around? How can we get schools to prioritize recess and real recess, right? Not just like indoor recess where they're sitting around or just having downtime, but like they're running outside and doing things like that. And so all of those things play into health as well. Childcare gaps where parents are working multiple jobs and they can't afford childcare, and there's a lot of issues there. All of these things, they play into the social determinants of health for everyone, but they directly impact the health of children as well.
It's true. I think ultimately the interconnectedness of the social determinants of health is really something that a lot of researchers have looked into for years and decades. And it's often the case that a family doesn't just have one social determinant of health identified. It's often multiple things that are interconnected, as you mentioned, because they're so related. I was looking at this analysis that was done years ago about proximity to community pools and community playgrounds. And I think communities that just had more access to those, particularly ones that were lit at night so that families could access them after hours. It was an interesting analysis that was being done around movement and the access to that as being part of children's health.
Yeah, absolutely.
Jessica, thank you so much for taking the time. Appreciate your insights and your thoughts on all these topics, and would love to bring you back at some point when we have other topics to talk about as we think about social determinants of health and children's health.
Yeah, I appreciate you having me on and thanks for the work you're doing.
And now a thank you to our generous sponsors.
All right, we want to thank our sponsors for A Dose of Optimism. Our first sponsor is Nabla. Nabla, this will help keep us practicing longer. For 85,000 clinicians and counting, Nabla is the key to better balance. With real-time notes and dictation in one platform, clinicians are saving hours on documentation time and strengthening patient satisfaction. Learn more on nabla.com. And to Mercury Bank, online business banking for startups and small businesses. Go to Mercury Bank for powerful banking, simplified finances. And finally, we want to thank our presenting sponsor, KidsX. KidsX is a global ecosystem of pediatric innovators anchored by a consortium of the leading children's hospitals motivated to accelerate health innovation and transform care in pediatrics. So we've talked about food deserts and other structural issues that are contributing to food insecurity in America. Next, I talked to Adam Dole. For those of you who know Adam, you know he's an incredible innovator. He's worked at NASA on Mars missions. He's worked at the Mayo Clinic, even the White House as a Presidential Innovation Fellow. Adam has a passion for social impact. You're going to feel it the minute you start listening to the interview. And most importantly, Adam is the CEO of a company called Bento. They're focused on medically tailored grocery delivery to help families who are experiencing food insecurity. So our guest today is Adam Dole. Adam has such an amazing background in healthcare innovation. He's worked at NASA on future Mars missions. He's worked at the Mayo Clinic, even the White House as a Presidential Innovation Fellow. Adam has a passion for social impact. You're going to feel it the minute you start talking to him. And most importantly, Adam Dole is the CEO of Bento. Adam, thanks for joining us.
Thanks so much, Omkar, for having me. Really appreciate the opportunity.
So Bento is a platform that connects patients that are struggling to access healthy food. It connects them with free meals and groceries. It's developed by you, Adam, and Mick Eberling through Not Impossible Labs. For those who are unfamiliar, these guys work on amazing moonshot-type concepts. In 2022, Bento was named one of Time Magazine's best inventions. Later, it was named as Fast Company's World-Changing Ideas finalist. It's pretty impressive. So rather than requiring people to visit a food pantry, which of course is also a great option for many families, Bento's patients and families, they just text a code. Like, for example, the word hungry. They'll text that and they'll get access then to nutritious food that's delivered from a nearby grocery store or restaurant. That order is prepaid through Bento's system. It's often funded by Medicaid or sometimes a charitable donation or maybe a hospital or a healthcare sponsor. So the patient and family, they pay nothing. Adam, do I have this right? Walk us through how Bento works.
You got the broad concepts right. I'll provide a little bit more detail in terms of how it works and some of the ways that we've evolved since the beginning. But started Bento really to address the fact that there are 50 million people in our country that don't know where their next meals are coming from. And despite the best intent of a lot of solutions that exist, that our country and community members rely on, they exist, but they're not necessarily enough to get the job done at what we believe is a very preventable issue in our country around food insecurity. We're the wealthiest country in the world. We've got more than enough food in it to feed everybody. And yet the problem has only gotten worse over the years, not better. And so we look at a lot of the existing solutions really as inspiration to say, all right, how do we go beyond asking low-income community members to oftentimes leave work or school early to stand in long lines at food pantries to receive a box of food that might be well-intended, but because it's been donated, might have things in it that might be doing more harm than good based on an individual's disease risk factors, all while asking community members to have to set their dignity aside to participate in some of those experiences. And we felt like there was a better way. And so we created this platform 5 years ago, which started connecting people to restaurants in a way that curated restaurant items for them to be able to pick up in a really stigma-free way, but quickly evolved to including groceries as the primary source of food for many reasons. access to the entire grocery store. It gives us the flexibility to curate groceries based on people's disease risk factors, any other nutritional requirements that they might have, cultural preferences. And then we make those choices available to our community members, and they're able to select which grocery order they want. We now have evolved beyond just text messaging as well to include web-based experiences, which allow our members to have a much more feature-rich experience with selecting their groceries, getting the right education around how to best use the groceries on a weekly basis, other health education that they're able to engage with that way as well. Ultimately, to stabilize somebody's most basic human needs around access to nutritious food in a way that's convenient for them, in a way that's aligned with their disease risk factors and health needs, and in a way that maintains their dignity, which is a key component of our solution.
Yeah, let's talk about that. It's incredibly important to focus on dignity and privacy. And you've mentioned that a few times already. From what I understand, the entire system really doesn't know that the person that they're delivering food for is food insecure. The delivery driver, the grocery store, the bags, like the packaging, it's all done in a way that orients around dignity and privacy. Walk us through more of that. And why is that important?
I appreciate the ability to dive into this one because it's such an important aspect and it gets a lot of head nods, but most people don't fully appreciate just how important it is. When you think about the existence of somebody who's experiencing food insecurity, they're probably at a poverty level and a socioeconomic level that is putting a daily existing stress on their world. And it oftentimes can become paralyzing, and that just becomes their norm. And oftentimes, they are being asked to participate in a system that is well-intended. There's great services that can help them, not just from a food perspective, access to other resources. And oftentimes those services have been designed not intentionally with a lot of stigma, but just because that's the way they've been designed. That stigma is something that a lot of community members have just gotten used to, but nobody aspires to having a stigmatized experience around being ashamed based on their socioeconomic level, but having to participate in them to be able to put food on the table for their family or meet their basic human needs. And so we just felt like people deserve better. We want to create something that no matter who they are, we're proud of that experience, and it would be the experience we'd want for our own loved ones. And so starting with making sure that people have choice, that's a major thing. And that the choice from a weekly perspective is different grocery orders that are coming from the grocery stores in their community or nearby communities. These are the same grocery stores that we shop at: Albertsons, Kroger, Whole Foods, Aldi. Goes on depending on the region. But these are the types of grocery stores that have a brand recognition in people's communities. And most of our community members aspire to be patrons of, so that they can select their own food. And so we make that experience available to them. And when they place that grocery order through our system does all the curation from the back end to make sure that that order gets placed to that grocery store using their online workflows. Those grocery stores already know how to accept online orders. We're just another online order to them. They know how to pick that order off the shelf, pack that order into Albertsons branded bags, not Bento branded bags that scream type 2 diabetes management or food insecurity or any number of qualifying reasons why somebody might have gotten access to Bento. And when that delivery is made with those groceries to that member's preferred address, that delivery person does not know that there's any difference between this grocery order and any other grocery order that had been placed online to that retailer. That is just one of the types of experiences that, when it's architected in sequence, really create a differentiated experience that our members appreciate and feel. And we are the recipients of a lot of feedback from our members telling us how much they appreciate real groceries from the grocery stores in their community in a way that doesn't stigmatize them. And because we have access to the entire grocery store, these are not just groceries of shelf-stable goods or fruits and vegetables. It's access to the entire grocery store, which includes lean proteins in the form of chicken and fish and tofu and other things that people want to eat and use. Of course, we've got access to fresh produce and vegetables and fruit, make sure everything's in season and exciting for our members, and then shelf-stable goods in the form of pantry essentials, but also things like olive oil and different spices and other things that are just practical, but also make these very desirable grocery orders for our members. That entire experience can be done in a way that does not stigmatize it.
That's incredible. You were telling me about a story about it, something related to hummus, right? There's like a patient who had never had hummus before.
That's right. There was hummus in one of the orders that one of our members ordered. And in a monthly coaching session with one of our health coaches, that member told us that they were initially extremely hesitant to try it because it was new and they had never had it before. They thought it might taste gross. And actually, they ended up having it. And some of the meal suggestions and snack suggestions, they were dipping carrots in that hummus, and they discovered that not only did it taste good, but now they're obsessed with it and they can't get enough of it. Our members oftentimes are learning about new foods through either just the curations themselves and the tips and tricks, or through the health coaching that we provide to them as well, to get people comfortable with making some of these small behavior changes that actually can lead to a lot of pretty fundamental behavior changes in terms of people seeing their health condition in relationship to the food that they're putting in their system and starting to make that connection between the two in a way that empowers them and starts to create a different long-term behavior change framework for themselves. And that's something that we see time and time again, which is a direct result of all of the little design decisions that have gone into this experience for our members.
Who pays for this, right? Like Medicaid or other health insurance plans, they are seeing the connection between healthy food and reducing avoidable ER visits and hospitalizations. Is that right? Are you a covered benefit now for any health insurance plans?
We are, yeah. So today we contract directly with different health plans to make this available to eligible plan members that meet certain eligibility criteria that the plan establishes. And so we are a provider of a number of different services that together create the Bento experience. Things like nutrition assessments to make sure that we are identifying our members' individual risk factors that have to be considered when we are matching them to the appropriate nutrition profile in our system. Every grocery order gets facilitated on their behalf. Many of our contracts include monthly coaching sessions to make sure that people are feeling supported and getting some of the education that is a bit more on the actionable side of education, but having that human connection with a health coach on our side is a critical component of our behavioral economic framework. And then care navigation has become a bigger part of the contracts that we establish so that we can ultimately make good on the value proposition that we set out to deliver, which is addressing some of these basic human needs in the way that we are using food, a great engagement catalyst to get people engaged in their healthcare resources. And we don't want to leave things up to chance. We don't want to just feed somebody great food and make sure that they're getting the right nutrition and hoping that they engage in the healthcare system as a result of having that stability. But we want to actually do our part and connect the dots and make sure that no member is falling through the cracks. And that's something that care navigation allows us to make sure is happening. So if somebody has become eligible for Bento, it's oftentimes the case that they might have been disconnected from their healthcare for a long time, maybe their entire life for all intents and purposes. Bento can become a great bridge to get somebody engaged into the healthcare system and earning the trust. So we can say, after your third or fourth grocery order, it looks like you haven't been to the doctor in over a year or more. Can we get that set up for you? And then taking the steps to make that easier for that individual to participate.
Originally, I thought Bento was a medically tailored food delivery business, but after talking to you, it sounds like you do both. You're doing the food delivery, but you're also helping navigate care. Now, Adam, last question. I read a quote from you. One of the biggest misconceptions is that we have to be a nonprofit to address food insecurity. So from that quote, I'm taking that you're basically saying that just charitable efforts to tackle food insecurity are not going to be enough, at least at scale. Bento is a for-profit company, right? But you're solving a very societal problem. Is there a dissonance for you there?
I love this topic because there is this sense from many parts of the ecosystem that we're engaged with, whether it's from the healthcare system, the local ecosystem of services that are meant to support low-income community members, and anything in between, to work on a topic such as food insecurity or addressing the unmet needs of low-income community members, that it's best done by nonprofits. I think, not to speak negatively about any of the nonprofits that are out there doing the best they can, they're just oftentimes not in a position to truly eliminate the problem that they are trying to address. And that might be for many reasons. But on behalf of being a for-profit company, what I can say is we are highly incentivized to succeed at eliminating the problem that we're set out to address. And being a for-profit gives us access to being able to hire individuals that might not be interested in working for a nonprofit. So we've been able to hire some of the world's leading technologists that are supporting the infrastructure on the back end for Bento that's allowing us to scale and ultimately reach more community members in a way that doesn't require us to own inventory of food and deal with a lot of food waste and a lot of inefficiencies. And so we're able to create a lot more efficiency on the back end so we can create a better human experience on the front end for our members. And our members should never have to know whether we're a for-profit or nonprofit. They just need to know that this is a convenient, stigma-free, and ultimately nutritiously accountable solution that's helping them address the basic unmet need. And it would be very difficult to deliver on that if we were a nonprofit that had very little resources to be able to invest in the capabilities and in the resources that are driving the solution here. And so we're very proud of the fact that our incentives are aligned, the outcomes that we want to achieve, and we want to raise the bar for our country to expect better outcomes from solutions that are addressing the unmet needs of low-income community members. It's going to take a village. It's going to require lots of different solutions, and nonprofits should absolutely be participating and be a component of them if they're driving the right kind of outcomes. And we want to hold ourselves accountable to making sure that we are a cost-effective solution for the healthcare system to be able to drive the best kind of healthcare outcomes at scale.
Adam Dole, thanks for coming on. This has been a lot of fun. Really appreciate what you're doing in this space, and thanks for sharing your story.
Absolutely. Thank you so much for having me and appreciate the opportunity to share.
All right. Thank you for joining us for your dose of optimism. Make sure to check out our show notes to get more information about our guests and the work they're doing. Visit our podcast page on the KidsX website to join our podcast community and to learn more about pediatric innovation. Thank you to our sponsors and to our presenting partner, KidsX. Please subscribe wherever you get your podcasts, and remember, it takes a village to make sure our kids grow into healthy adults. So volunteer at your local library, help out at the community center, and thank your crossing guard. And if you're so inspired, donate to your local children's hospital. All right, see you next time.